It's time now for our weekly checkup with Dr. Isaac Bogoch. Dr. Bogoch, good to see you. Happy Tuesday. Let's get into this morning. There have been a small number of confirmed Nipah virus infections recently in West Bengal, India, and the disease has caused outbreaks in Bangladesh before. So this is not something new, just to let our viewers know. But can you explain what makes Nipah so concerning and how serious the current situation is and whether Canadians should be worried about it?
Yeah, thanks for bringing that up. This is a very rare infection. It was identified in the late 1990s. And as you point out, it's been identified before in India and Bangladesh and also in Malaysia as well, where it was first discovered. It's transmitted to humans from other animals, sometimes pigs, sometimes bats, and sometimes ingesting food that's been contaminated with bodily fluids from those animals. And again, while it's very rare, it does cause a significant and severe illness. The illness is primarily a brain illness. It can affect every organ in the body, but it causes profound inflammation of the brain, and it has a pretty high mortality rate. Fortunately, it's exceedingly rare, and the outbreaks that we've seen to date since the late 1990s, when it was first identified, have been relatively small. So, the risk to Canadians is negligible. Even if traveling to an area where there are cases. But standard precautions remain. You don't want to be in close contact with bats for a variety of reasons, including this. And same with avoiding farms. People shouldn't be on farms, especially in close contact with animals in other countries, unless they have the appropriate protection.
Okay, so it's good to know that the risk to Canadians pretty low. However, Dr. Bogoch, many people are probably planning trips for their March break if they haven't already done so, or people even opting to travel sooner because it's been so cold here in Toronto. They want to escape. So what should they know about health risks in certain tropical places or these popular beach destinations outside of Canada? What would you advise them to do to stay protected?
The best thing to do is to get medical advice before you go on a trip, especially to a tropical area where there's infections that we don't routinely have here. And a good travel medicine specialist will be able to support families and patients and people with good advice on how to prevent infections transmitted from food and water, how to infections transmitted through insect bites. And sometimes people are traveling to areas that have, for example, malaria, where you can take tablets to prevent this infection, which can be very, very severe. It's a very common infection globally. And again, some smart steps you take before your trip can ensure that you have a healthy, safe, and happy trip. Avoid bug bites, appropriate food and water decisions, and you'll have a healthy, happy trip. But get advice before you go from a trained professional.
Okay, that is good advice. Are there certain places in the world where if you're traveling, whether for short term or long term, you'd advise people to get a vaccine or something even more kind of, easier, like more serious than taking a malaria pill, for example?
Yeah, I mean, absolutely. And the world is a huge place, and there's lots of different infections in different parts of the world. Here's one of a lot of different infections you can get, but a travel specialist can help guide through this. So, for example, in South Asia, there's a lot of typhoid. And of course, in Canada, if you go to a pre-travel clinic, you can receive a vaccine that helps significantly reduce your risk of typhoid. Globally, we see a lot of hepatitis A. It's transmitted through contaminated food and water. Hepatitis A is a terrible illness. It causes a very severe acute inflammation of the liver, and it's completely preventable. And, hepatitis A vaccines, for example, can significantly reduce the risk of getting this very preventable infection. So a lot of it depends on where people are traveling, because the advice is going to differ depending on where people are going. But as always, it's a good idea to ensure that you reduce your risk of bug bites through the use of DEET or icardin products, the insect repellent, and ensure that you're drinking clean water and high quality food to avoid the risk of gastrointestinal illness. One of the good piece of advice is, boil it, peel it, cook it, or forget it if you're traveling to a place that doesn't have the same hygiene and sanitation infrastructure.
Yeah, I really like that one. I think we've been through the 4 things you should do when you travel. Dr. Bogoch, that's our time. Thank you so much for joining us. Have a great week, and we'll chat again soon. Take care.